All right, everyone. In this video, we are going to go over joint immobilization. Specifically for this video, we are going to do a shoulder dislocation. But just like long bone, take these skills and be creative with them to apply them to other joints in the body: elbow, wrist, knee, ankle. You just have to be creative. So for this one, we're going to do a shoulder. So we need to immobilize the shoulder and then the bone above and below. So our bones above and below the shoulder are actually the collarbone and the scapula. And our bone below is the humerus. So we need to immobilize all of those with this. So what we're going to do is a sling and swath. So the equipment that you'll need for this is a triangle bandage. I've already got it all unrolled here. An ace wrap. And a 5x9. So to start with, as we come in and approach our patient, we've got our BSI on, our scene is safe, and the first thing we're going to do is Paige is going to come up and she is going to stabilize that arm. So she's going to come underneath, she's going to support underneath the elbow, help take some of that pressure off of the joint, and then you'll notice that as she grabbed it, she moved that arm up and across the chest. As long as you can do that without pain or feeling any resistance, this is the optimal position. If you feel resistance trying to move it, or your patient screams in pain, stop, get creative, find another way to immobilize it that doesn't hurt your patient. So, we've got it stabilized here, so I'm going to check CMS. So I'll grab a radial pulse, nice and strong. Samuel, can you wiggle your fingers for me? Beautiful. Without looking, what finger do I have?
Middle.
Excellent. So CMS is intact. So now I'm going to prepare my equipment. I'm going to grab my triangle bandage here, find the long end of the bandage, reach down and grab the point opposite the long edge. And we're just going to tie a simple knot in that point. So I've got my simple knot there. What that does for us is it creates just a nice pocket in this triangle bandage. So now, very carefully, I'm going to feed this underneath Samuel's arm, being sure to get that knot nice and high up on his arm there so that it cups the shoulder. I'm going to pull this end so that it encompasses his whole hand, so his hand's not just dangling there uncomfortably. Now I'm going to take the back part that's against his chest, and that goes over the same side as the affected shoulder. The one that cuts across the front goes over to the unaffected shoulder, helps just support that elbow really well. Now once I got it, I'm going to pull a little bit just to make sure that it's nice and taut. Paige will let me know if once it's supporting that arm, so I know that I'm in a good spot to tie. Does that feel good, Paige?
Yes.
Okay. So now I'm just going to tie a knot in the back here. I like to just tie it just like my shoes. It makes it easy for the hospital to undo later when they go to fix Samuel's shoulder. So now this is where your 5x9 comes in. Take your 5x9, leave it nice and folded, and just tuck it behind that knot. So it's between the knot and your patient's skin. Because eventually that knot will really start to dig into their neck, becomes very uncomfortable. So we want to make sure this is as comfortable for the patient as we can, so pad that. Now that that's secure, Paige can slowly try and let go. We'll know that we did this correctly if the patient's arm doesn't move at all when Paige lets go. So it didn't move, it didn't fall. Samuel, is that pretty comfortable right now?
Yep.
Arm nice and relaxed. Okay, so the last thing we need to do is I have prevented some movement, but if Samuel wanted to, or if we moved him suddenly, his arm can still swing a bit. We don't want that. So the next part we're going to do is called a swath. So we're going to take our ace wrap here. Samuel, can you lift this arm up for me? Thank you. And we're just going to pass this behind his back, nice and down near the elbow as we can. And just wrap this around till we run out. Make sure that it's not too tight. You know, I'm not trying to strangle Samuel or prevent chest movement, but it should be nice and secure. Now we can lower his arm back down. Now it helps prevent that forward movement of the arm. So now that this is all secure, I'll pass my hand in here and check circulation. I can't quite get to the radial pulse, but I can check cap refill, which is normal. Samuel, can you wiggle your fingers?
Mm-hmm.
Excellent. Without looking, what finger am I touching?
Middle.
Excellent. So now that arm is properly secured, so we can work on getting him to the stretcher and transporting him to the appropriate facility.